Welcome to the World Vitiligo Day 2020. It is my great pleasure to share with you some new concepts and new treatments of vitiligo in this very special day. Today, the main quarter of the World Vitiligo Day is the beautiful and historical city of Niš in Serbia, Europe, and it is under the presidency of Professor Iva Bilic. But the World Vitiligo Day is celebrated all over the world, in the 5 continents, and our message and our sharing is global this year as usual. I have 3 short points to share with you with all my pleasure. The first one is that vitiligo can be treated successfully in up to 72% of the cases. I put this as the very first point in my sharing, in my presentation to you, because too often doctors say to vitiligo subjects that there is nothing to do. It is not true. Today we have physical devices, for example the irradiation with ultraviolet B 308 or 311. We have pharmacological treatment, both external, the most well-known are corticosteroid and tacrolimus, but there are many others, and internal treatments, including monoclonal antibody, which can change and will change the destiny of repigmentation in vitiligo subjects in the best way. My second point is that vitiligo should not be considered simply as a form of aesthetic disorder. No, it is obviously an aesthetic issue because it has a very strong impact on the self-image and also on the self-evaluation and on what is dealing with the relationship of the vitiligo subject with the rest of the world. But I would like to stress the concept that vitiligo is a systemic disease, and even if they are not serious issues in the body, in the whole body, vitiligo is always a medical issue and not a cosmetic issue. We know, for example, that thyroid in the form of Hashimoto thyroiditis can be of interest at least in 38% of subjects with vitiligo. And many data are now emerging and becoming more and more clear about metabolic disorders in vitiligo and alterations of the cochlea, of the inner ear, and also of the melanocytes in the eye. So I think that vitiligo should never be considered a simple cosmetic issue, and that these white patches which are evident on the skin are only a part of the overall issue of vitiligo. My third point to share with you is that there are very many new treatments for vitiligo. And first of all, I think that we should consider vitiligo as an umbrella. And under this umbrella, we should consider that there are very many different forms of the disease. In other terms, each and every vitiligo patient, each and every vitiligo subject will show the white patches. This is obvious. There is no discussion about this. But the origin and the manifestation and the pathophysiology and the physiopathology of these patches can be different from a subject to another, and also in the same subject in different time of the evolution of the disease. These changes in the profile of vitiligo is the origin of many different treatments which can become extremely powerful in inducing repigmentation at a certain stage of the disease, and then can become less and less powerful and can be inefficient. Today, still, we consider the best treatment on a triad of three combined treatment. First of all, irradiation with narrowband UVB, both 311, the so-called narrowband, and the 308 are equally well functioning. They can be used in hospitals, but now there are also some devices which can be used by the patients in cooperation with the general practitioner. Then some local treatments, and they include potent corticosteroids as a cream or as an ointment, and the tacrolimus in ointment. We should not go too far with corticosteroids because of the side effects, and usually repigmentation starts in 7 to 11 weeks. After this, if there is no repigmentation, it means that this kind of treatment is not good enough. We should never forget that systemic treatment are excellent in different cases of vitiligo subjects. And we go for corticosteroids, the so-called mini-pulse therapy, use of low doses of corticosteroid, oral corticosteroids only in the weekend, or 2 days per week, as you wish. And we then end with the new monoclonal antibody, which have a complex interaction with the antigen-presenting cells in vitiligo. There are some newcomers which are extremely effective. One is latanoprost, and the other is the so-called fractional laser, or its mechanical equivalent, which is the needling, that induce some micro wounds in the vitiligo area, and this produces itself repigmentation better if it is associated with the distribution of latanoprost or corticosteroids over the skin. I am reaching the end of my sharing with you, and I would like to thank you for taking part into this World Vitiligo Day 2020, and to give you a message of good hope. Vitiligo can be treated. Vitiligo need medical assistance, need very often also psychological assistance, and vitiligo is an issue which is important for you, is important for me, is important for all of us, because we all are fighting the same battle, and at the end we shall win.